Had I had a structured medication review, I feel that I wouldn't have had the complications that I ended up having.
It's really important that you understand why you're taking lots of medications. A structured medication review just provides you with that space to talk to your doctor.
A structured medication review, it's a conversation between a patient and their clinician to review the patient's medicines and make sure that it's still the best medicines for them. A structured medication review would most commonly be done by a practice pharmacist working in a GP surgery. However, they can be done by the GPs themselves.
What we really want to find out is what matters to the patient in terms of their health goals. How do they feel about their medicines? Are there any medicines that they don't feel are working? Are there any medicines that they feel are causing side effects?
Hi Fiona, my name's Hadiel. I'm one of the pharmacists at the practice. You're here today for a structured medication review appointment, is that right?
Yes, please.
So have you had one of these before?
I haven't, no.
I'll tell you a little bit about what we'll be doing in this appointment. So really, it's just an opportunity for us to have a chat about your medicines and make sure that everything that you're taking at the moment is still the best thing for you.
Reviews are so important to sort of go over things, remind you of things, ask you if you're okay, and give that patient the opportunity to say, well, actually, are there any alternatives?
Structured medication reviews can be done over the phone, depending on the preference of the patients, but you can also have structured medication reviews done face-to-face, where the patient comes into the practice, and sometimes patients will have their structured medication review even in a home visit.
This review is not about saving money, it's not about taking away medicines that somebody doesn't want me to take away, and it's okay for them to tell me if they're not taking their medicine. I'm not going to tell them off.
Sometimes it can come to light that one of the best actions is actually to stop a certain medicine. It's always a shared decision, and if you both come to the agreement that actually maybe it's better that we don't take this medication for a while, you're not necessarily going to stop it forever. It's often that it's more of a trial without that medicine, so that if things don't work the way that we think they might, if they don't feel better off this medicine, there's that opportunity for them to then restart it and trial with it again.
My dad was wheelchair bound, so I attended all his appointments with him, and it made me feel like I was giving him the right meds, because before it was like a bit ad hoc, not understanding which med is for what, and I think the review clarified all that. And my father as well, he understood why things were being reduced. He didn't think that dosages could be reduced, he thought he was on the same meds for life.
Having those information sheets before you go to the doctor's appointment is really good, because you can really sort of think about what you want to ask. It's just another form of communication and clarification that you're okay to voice things and ask things.